If your kidneys fail in America, there's already a system ready to profit. I'm Herbert Denard, and welcome to Dialysis, a system built for treatment, not prevention. Dialysis clinics are showing up in our neighborhoods more than ever before, and for too many families, it's become normal. 3 times a week, hours at a time, for years, a machine doing what the body can't. But let's ask the real question. How did we get here? Kidney failure doesn't happen overnight. It starts quietly. High blood pressure, diabetes, the foods we grew up loving, fried foods, pork, heavily seasoned meals, pig feet, pig ears, chitterlings, meals that once helped our ancestors survive, but today are slowly breaking our bodies down. Add in stress, limited access to care, and fewer doctor visits. And year after year, the damage builds. In too many low-income communities and in Black communities, these problems go untreated for far too long. So by the time people find out something is wrong, it's already too late. And when it's too late, there's only one option left: dialysis. Now, let's be clear. Dialysis saves lives. Without it, people with kidney failure would not survive. But dialysis is not a cure. It's a system. 3 days a week, 4 hours at a time, year after year, keeping people alive but locked into treatment. In 1972, the government made a decision. If your kidneys fail, dialysis will be covered. And that decision saved millions of lives. But it also built an industry. Today, dialysis is one of the most organized and most funded systems in healthcare. Clinics are a place where the need is highest, and that often means communities already struggling. And that connects to something bigger, the medical industrial complex. The medical industrial complex, or MIC, is the network of hospitals, pharmaceutical companies, insurance providers, and corporate healthcare systems that profit from treating illness. It's not just about doctors and patients. It's an entire system where money flows when people are sick and continues flowing the longer treatment is needed. Nobody wakes up trying to hurt people, but the system itself rewards treatment over prevention. It responds when your body breaks down, not when it's trying to warn you. So the question becomes, if prevention works, why isn't it the priority? Millions are spent treating kidney failure, but far less is spent stopping it before it starts. And here's the truth. We already know how to prevent this. Check your blood pressure, control diabetes, test your kidneys early, eat better, learn better. But too many people never get that chance. No early screenings, no consistent care, no warning until the damage is already done. Black Americans are more likely to develop kidney failure, more likely to reach dialysis, and more likely to get there later when the damage is worse. That's not random, that's a pattern shaped by access, by education, by environment, and by a system that meets people at the worst moment instead of the earliest one. This system is not built to hurt people, but it is built to treat sickness more than it is to prevent it. And until that changes, we will keep seeing the same story. More machines, more patients, more families affected, because this didn't start in a hospital. It started long before that. I'm Herbert Denard, and this has been brought to you by the Just Walk Away Middle Georgia Initiative. Because together, we can walk away from dialysis.